Good morning. We begin this hour with news out of Canberra. The PM is turning up the heat on the big banks to provide bridging finance to businesses for wages until JobKeeper payments start next month. Leaders have revealed family gatherings, shopping and community sport are likely to be the first lockdown restrictions to be eased, but concerts, festivals and overseas travel will be last. It comes as the rate of new infections in Australia remains low, with no new cases in 5 states and territories in the past day, although the death toll has risen by 2. The Ruby Princess has finally left Australian waters, but questions still remain over why passengers were allowed to disembark despite coronavirus being on board. Businessman Clive Palmer has donated more than 30 million doses of an anti-malaria drug, which could be a treatment for COVID-19. And another 4.4 million Americans have filed for unemployment, lifting the number of people out of work because of the virus to more than 26 million. Meantime, the number of coronavirus infections in the United States has now passed 840,000. 185 countries have cases of COVID-19. Almost 2.7 million have now been infected globally. The death toll is approaching 187,000. But more than 727,000 people have now recovered after treatment and isolation. Around Australia, there have been 8 new infections reported in the past day. There are 6,660 confirmed cases. The death toll has risen to 76. More than 5,000 people are listed as recovered. New South Wales increased by 5 cases to 2,976. In Victoria, there are 1,337 cases of COVID-19. In Queensland, the total has risen to 1,026. Western Australia remains at 546 confirmed cases. South Australia has 438 people with coronavirus. Tasmania has reported 205 cases. There are 104 in the Australian Capital Territory, and there are still 28 in the Northern Territory. Live now to our reporters for new developments on the coronavirus crisis. First to Taylor Aiken in Canberra. Tough COVID-19 restrictions could be eased within weeks.
Yeah, slowly but surely, Nat. Good morning. The Chief Medical Officer, Brendan Murphy, saying those restrictions that could be eased first include those on retail, community sport and small social gatherings outside. But the National Cabinet would have to weigh up the risks to public health against the social and economic benefits.
Some relaxation of the size of small groups is possible. They will be in the mix for National Cabinet discussion, in 3 weeks' time.
The Chief Medical Officer has also flagged that restrictions on overseas travel will remain for at least another 3 or 4 months, but they could be eased between Australia and New Zealand. Meanwhile, Prime Minister Scott Morrison has blasted the major banks for delaying bridging finance until the JobKeeper wage subsidy package comes in. Already 275,000 Australian businesses have signed up, but with the money not due to flow until early May, many businesses have been left with an anxious wait. The banks have promised to set up a hotline, and that will be expedited, with many customers urged to call up and speak to someone if they have any questions. Now
Amber Laidler is in Sydney. Amber, coronavirus-riddled cruise ship, the Ruby Princess, has finally set sail.
Yes, Nat, the Ruby Princess left Port Kembla late yesterday afternoon, leaving behind 33 crew members here in New South Wales Health managed hotels. They are showing some symptoms of COVID-19 and they will remain here in quarantine until they are medically cleared. Despite the ship leaving, the investigation into the deadly outbreak on board continues. That special inquiry yesterday heard from the ship's hotel manager, essentially the ship's second in charge, and he said he too was shocked when passengers were allowed to disembark here at the overseas passenger terminal on March 19, despite authorities still waiting for the results of some COVID-19 test results that had been taken from passengers. That inquiry is set to continue at a later date. Meanwhile, there has been another death linked to the Newmarch Anglicare aged care facility in Western Sydney. A 79-year-old woman has become the 4th person to die at that home. 44 confirmed cases so far. There was an information webinar hosted by Anglicare for residents and family members last night. It is reported that families have been told to update end-of-life plans for their loved ones, Nat.
Okay, thanks, Amber. In the US, applications for jobless benefits continue to soar during coronavirus lockdowns, while in the UK, a Kiwi nurse has opened up for the first time about treating a very high-profile patient. I'm joined now by Paul Caddick in New York and Sarah Greenoch in London. Paul, first to you, just how many jobs there have been lost?
Good morning, Nat. These numbers don't get any better. 4.4 million Americans filed for unemployment just last week, and that means over the last 5 weeks, 26 million Americans say they've lost their jobs. That pretty much wipes out all the jobs gained over the last 10 years since the GFC. Now, those bad numbers come as the Congress is today voting on a new stimulus package to help small business, to help hospitals, to fund virus testing. It's worth about $750 billion Australian. And they've had to bring on this new stimulus because the last stimulus fund, which was worth about $500 billion Australian, all that money got used up in just 2 weeks. Now, this comes as some states are looking to make the first steps to reopening their economies. But the mayor of Las Vegas has caused a bit of a backlash after urging the casinos along the famous Vegas Strip to reopen, but not giving much guidance as to how to do that safely. She's even suggested that the city could be used as a control group, an experiment to see how the virus would be affected if a city suddenly reopened. This is some of Mayor Carolyn Goodman.
So you don't believe there should be any social distancing? You don't believe that this is
Of course I believe there should be. Of course. I'm a
How do you do that in a casino?
That's up to them to figure out. I don't own a casino. I don't know anything about building
Wait a minute.
Now, the union that represents workers who would be staffing those reopened casinos calls the idea of being used as an experiment disgusting. The governor of Nevada said he was appalled at what the mayor had been suggesting. Important to note, probably thankfully some might say, that the mayor of Las Vegas doesn't actually have any authority to reopen those casinos.
Okay, Sarah, the New Zealand nurse who looked after UK Prime Minister Boris Johnson has spoken. What did she say?
She has not. Jenny McGee said it really didn't sink in that she had been caring for Boris Johnson in hospital until the PM personally named her and thanked her on national TV. He spent 3 nights in intensive care earlier this month, and Jenny from New Zealand was one of 2 nurses who stayed by his bedside for 48 hours when he said things could have gone either way.
To be completely honest with you, I've worked in intensive care for 10 years. I'm a sister, I've been in charge for 5 years. I've been in really stressful situations and I was not fazed by this. This was just another day at the office.
Boris isn't back to work yet, but he has overcome COVID-19, as has Prince Charles, who today released a beautiful new photo of him hugging one of his youngest grandchildren, little Prince Louis, who turned 2 today. And this evening, the Cambridges and Charles and Camilla have all been seen at their respective homes, cheering and clapping for our carers, which has become a Thursday night tradition here in the UK. Nat?
Thanks very much, Sarah.
Now, businesses struggling to pay their workers during the pandemic will have their cases fast-tracked by the banks. The Big Four banks have been urged by the Federal Treasurer to push employers who need bridging finance to the front of the queue. More than 275,000 businesses have formally applied for the JobKeeper wage subsidy, but the payments won't start until next month. For more, we're joined by the Chief Executive of the Australian Banking Association, Anna Bligh. Anna, good to see you. Why has it been so difficult for employers to access finance from their banks?
Well, good morning, David. I think it's important to acknowledge that so far we've seen $700 million of lending go out to businesses who need it. So there are many hundreds of thousands of businesses who've already been helped. But what's clear is more needs to be done.
Yep.
Banks, to that end, banks have agreed to take every action they can and pull out all the stops to make sure that those businesses who need it by next week can get to the front of the queue if they're still waiting and get the money they need.
OK, so how can businesses fast-track this?
So many businesses, as I've said, have already got this assistance, and I really want to reassure your listeners who are waiting to hear back from their bank or aren't sure if they can get this money. There will be operational hotlines dedicated for businesses looking for JobKeeper payments, operational today. Those numbers will be advertised, and I encourage everybody who needs this by next week to get onto those hotlines or go online and see where their bank is offering fast tracking online.
Because some of the second-tier banks are offering it as well, aren't they? Sort of the likes of Judo Bank have access to this government funding to help.
Every Australian bank is offering, every Australian bank that's a member of the ABA is offering this. So whether you're banking with one of Australia's regional banks like Bendigo or BOQ or Suncorp, whether you're banking with a major bank, and as you say, some second-tier lenders are also there to help. But by what we know is important here is that people get the help they need when they need it. And we're only having this conversation, David, because the whole country is dealing with something so big that no system is built for it. I take my hat off to the men and women on the front line of these call centres in our banks. They have already processed more in a couple of weeks than they would normally do in a year. They have been working frantically, helping families, getting mortgage relief, helping businesses get the money they need to get over this hump until JobKeeper payments can be made.
Put more on the front line. We need the cash to come through. Anna, thanks for your time. Here's Sam.
Controversial businessman Clive Palmer has donated more than 30 million doses of an anti-malaria drug to the national stockpile. Hydroxychloroquine has been touted as a possible treatment for coronavirus, although it is still being trialled and there's mixed results overseas. Mr Palmer says his foundation has paid for the medication and he wants it to be provided for free. And Clive Palmer joins us now from Queensland's Sunshine Coast. Clive, hi. A lot of hype over this drug, and the trial is going on in Brisbane. It's at a Brisbane invention. There's limited evidence that it's effective as a COVID-19 treatment. Do you know something we don't know?
Well, there's not limited evidence, really. I mean, the Health Minister, Greg Hunt, authorised the use of the drug in hospitals on the 2nd of April, and we've seen since that time Australia have the lowest mortality rate in the world, and we've seen the curve flatten. That's very encouraging. But also, if you go around the world, you'll see if intervention takes place prior to people being put on a ventilator, it's successful. And we know early intervention in any disease is very important. The reason I funded $1 million for the trial was so we could get this happening. But more importantly, if we have a successful trial and we don't have the drug, what good is it? And right around the world, the demand's gone up. In Australia, 6,000 doctors have had it prescribed for themselves and their families. Doctors surveyed throughout the world say it's the most effective treatment. So I wanted to make sure that if the government wants to approve it, if it wants to allow it out, we'd have the material. So I moved in March to acquire 33 million doses.
All right, so Donald Trump...
For this country.
Well, Donald Trump liked the look of this drug too, but you've bought more doses of it than the United States. Why did you buy so many, and would you consider now donating them perhaps to America, who's much worse hit than us?
No, I did that for Australians. This is my country, and I spent the money with my money. I took the risk, and if anything goes wrong with it or it doesn't work out, all that's happened is that Clive's lost a bit of money. But most importantly, we've got to be there to protect and defend our own country and provide it for our own people. And of course, the reason I've donated it is because I want it free of charge to anyone that needs it, regardless of how much money they've got. And I think that's very important.
Okay. All right, Clive Palmer.
I should also add that the drug has a 3-year shelf life.
Sure.
It has a 3-year shelf life, and that means it'll be available for years to come.
And also perhaps if we have a second outbreak here, which we have seen in some places around the world, that it's still available in Australia. Well, look, Clive, let's hope it's a miracle cure. Thank you, and thanks for your time today.
That's a pleasure. All the best.